OBGYN's office. Do you have an appointment today? Okay, let me check. Can you give me your first and last name? And what time was it at for? Perfect. And can you confirm a good phone number for you? Okay. Any changes to address or insurance? No? Okay, and I just need a pharmacy on file in case they want to send you a prescription today. Okay. What city is that? Okay. Perfect. And you are already signed up for our portal, correct? So all your test results can go there? Excellent. All right. I am going to put you as arrived for the status, and then the medical assistant will bring you back to put you in a room. Okay. And to confirm, you are here for a birth control consult? All right, just making sure. I will have you take a seat right over there, and the medical assistant will bring you back. My pleasure. I'll see you at checkout. Hey you, nice to see you again. I'm so glad that we didn't scare you away. I heard we are here for a birth control consult. Cool. Do you have any idea of what method you think you're interested in? No. That's what our job is, right? To explain all the options, and you pick the one that seems to interest you the most, you know? Absolutely. I'm just going to clean off my stethoscope. Then we'll take your vitals. I'll get some history taking on you, and then you'll be all set to see the PA. All right. What's new? Family's been safe? Good. Love to hear it. All right. I'm going to take your temp first, so let me put on some gloves. Yes, I've been good. Thank you for asking. No new, you're not on any new meds, right? Okay. All right, temperature first. Yeah, we've been pretty busy lately, not gonna lie. All right, I'm gonna have you say right under your tongue. Perfect temperature. All right. We are all good there. Now let's do blood pressure. You could just rest your arm out. Yes. Yep, right there. Okay. That's not too tight, right? Good. Blood pressure's perfect, so we don't have to worry about that at all. All right, gotta ask you a few questions before the provider comes in. So let's get those questions going. consults, we have to make sure that you are someone who can be given the option of having birth control with estrogen in it, because some people are not candidates. So if you could give me your age, and do you smoke at all? Okay. If you are above the age, if you are 35 and above and you are a cigarette smoker, couldn't give you anything with estrogen, so it's good you don't smoke. Any known heart disease, liver disease, any history of blood clots? Anyone, like mom, sister, with any known blood condition or disorder? Very good. And then the usual questions: no medical conditions, not on meds, no surgery since I last saw you, still don't drink alcohol, right? No new diagnosis of cancer in the family. Okay. And any new sexual partners since I last saw you? Same one. And you still use condoms, of course? Good. Regardless of the birth control method you choose, condoms are the only thing that will protect you from an STI, okay? And of course, you're not really sure which birth control method you want. You kind of want to talk about all of them. All right. Now, with the birth control consult, are you interested in things like natural family planning, where it's sort of more of tracking ovulation, cervical mucus, or were you kind of more focused in on, implants, IUDs, pills, that sort of thing? That one? Okay. All right. I will be sure to let the provider know. Are you having any symptoms today outside of the birth control consult that you may need to get undressed for? Are you having anything vaginal going on? Nope. Okay. And no urinary symptoms today? Excellent. Or breast pain or anything? I know you just recently had your pap smear, so you've had a full workup, which is great. Now, any of your family members on birth control, have you heard any experiences with any sort of method? Keeping an open mind. Trust me, that is what you have to do, because you are always, I feel like online, you're always going to hear the worst case scenarios, but something I always tell people is everyone's body responds so differently to each birth control method, so you really just have to find the one that works for you and makes you happy. And sometimes it can take some trial and error, but we will get there. Good news is your blood pressure was perfect today. Sometimes if your blood pressure is a little too high, again, wouldn't really want to give you anything with estrogen. But I will go give these notes to the provider, and then she will come in, give you the birth control consult. Of course, always a pleasure seeing you, and Leanna will be in shortly. Hello, so nice to see you again. I hear we're going to be talking about birth control today. Perfect. And this would be your first birth control prescription? Okay. So I heard we're not really interested in talking about natural family planning. We're kind of looking for something a bit more effective. Okay, well, this is the fun part. Sit back, relax. No nerve-wracking exams today. I'll explain all the birth control types, the hormonal and non-hormonal, and then we can sort of, decide which one you want to start off with. Yes, so the good news is, according to Lee's notes, you are not, or you are an estrogen candidate, meaning you can be offered birth control methods with estrogen as well as the progesterone component. So what I usually like to do is I have a whiteboard here, just so you can kind of follow along and we can kind of figure out what's best suited for you. So with that being said, let's talk about the birth control types that have two hormones in them, estrogen and progesterone, okay? Now I'm going to write them here and then I will show them to you. So this category is going to be hormonal birth control. Now, one thing that I forgot to ask you is, how are your menstrual cycles usually? Okay. So they're not overly painful and they're not 7-8 days and super heavy and long. They're kind of normal. Right. Okay. So, good to know, because a lot of times I direct people towards certain birth controls depending on their menstrual cycles. So people who typically have very painful periods or very heavy periods, I usually direct them to the hormonal direction. Now, if you are someone whose periods were not very painful, 3, 5, 6 days in length, then the Paragard IUD would be something I'd be comfortable with giving you as well. But ultimately, it's your choice. It's just always recommendations I've made, and you'll see why later with the Paragard. So anyway, back to the hormonal birth control. These are going to be birth control methods that have estrogen and progesterone in them, 2 types of hormones. We are first going to talk about the pills, then the vaginal ring, or what they call Nuvaring, and then the birth control patch, which you may know or heard of as Torla or Xulane specifically. Okay? All right, so here's what we're working with. Hormonal birth control. These 3 birth control modalities have 2 hormones in them. Pills, Nuvaring, patch. The pills you would have to take once a day, every day. The Nuvaring is a vaginal ring that you would keep in the vagina for 3 weeks and then take it out week 4 to get a period. And the patch you would exchange every week and always change the spot that you place the patch. Does that make sense so far? Good. All 3 of these methods are around 93 to 95% effective with typical use, but can be much higher if you're very consistent and on time with taking them. All right, makes sense so far. Awesome. All right. Now, considering that they are made up of similar components, the side effect profile are very similar to these 3 modalities here. So I wrote them down for you. Nauseousness, headaches, irregular bleeding, amenorrhea, meaning no more periods, or mood swings. Now, everyone's body is different. You may experience none of these things. You may experience one of them. It's just kind of something you have to try out before you know. Now, these birth control methods are very good at treating things like painful periods, as well as conditions like PCOS, because they protect your uterine lining. So what I'm going to do is I'm going to kind of show you what each one of these methods look like. So hang tight for me. I think we're good with this. Yep, you understand everything. Now, the thing is, the nice thing about the pills is, usually I like to see you in 3 months to make sure you're happy with it, because at that point your body should have adjusted by then. And if you aren't happy with it, then we would just change up the dose. So with birth control pills, I have a packet I can show you, pages upon pages of different recipes, if you will, different dosages of the pills. And so we just have to find the one that works for you. So there's a lot of flexibility specifically with the pills. The patches and the Nuvaring are pretty much like a 1 dose option, maybe 2. All right. So, birth control pills. Birth control pills are probably the most popular birth control method that people start off with. So the ones I have on hand are Kariba, because these are the ones that I take. So let me open the pack for you just so you can see what birth control pills look like. Now, like I said, pills have different dosages. They're prescribed differently. So some people may not get a period row because it's their personal preference. Other people may have different doses each week. So with my pill pack, all of these are the same color because they're the same dose. And then these 2 are sugar pills, meaning there's no hormone in them. And these are very like a less estrogen dose. So I would get my period this week, and that's how a lot of them are designed. So really it's just a matter of your personal preference. But if you chose the pill, I would typically start you on a lower dose pill, and then we would move up if we found that you were getting side effects or your bleeding wasn't well controlled, that sort of thing. Yes, once a day, every day. I personally have an alarm set because I'm not very good at remembering to take them. So those are the pills. Now, we've got the Nuvaring. So for people who don't remember to take a pill every day very well, or they just rather pop a ring up there, leave it in for 3 weeks, and then pull it out week 4, this is the Nuvaring. It's a very bendy, flexible vaginal ring that you would just insert up there, and it would do all the work for you. So I always nickname it the birth control pill in ring form because they're very similar. I don't have a patch with me, but I got pictures for you. Birth control patch, you would change every week. Now, because your BMI is under 30, you are a candidate for this. Anyone with a BMI of 30 or above should not be given the patch because of risk for blood clots. Now, with the patch, though, if you decide to go with the patch, you have to change the patch location every week. You never want to put it in the same spot, but these are some of the 4 areas that you can put it. Any questions? No? Okay. So, I gotta ask, out of the pills, the patch, and the ring, which one is most appealing to you if you had to choose from the 3? The pills. Okay, we will keep the pills on standby and the other 2 will toss. Okay, perfect. Next category, let's talk about progestin only hormone options, meaning these hormone options, hormonal birth control options, have no estrogen. Yes, so the people who smoke or have history of blood clots, that sort of thing, these are the type of birth control methods that can be offered to them. So let me write here, progestin only. So a few fall in this category. So I will write them here. If you can give me 1 second. I'm horrible at multitasking. All right, I think I got everything there. All right, ready for the progestin onlys? Awesome. So this is what we are working with. Depot shot, which is a shot that you would get every 3 months. The hormonal IUD, which is an intrauterine device. It goes up, sits in the uterus, and can stay there from anywhere from 3 to 7 years, depending on which one of these you choose. Skyla being the lowest dose, in the shortest duration. Marina and Liletta being the higher doses, and Marina you can keep in for 7 years. And then we have the nexplanon. This is the rod in the arm that stays in for 3 years. And then I call them POPs. It just stands for progestin only birth control pills. So there are birth control pills that have no estrogen in them and just progestin. So as far as effectiveness, nexplanon and the hormonal IUD, both around 99% effective. Depot and the progestin only pills are like the last 3 options we discussed, around 95% with typical use. So what we're going to focus on here is the Depot, the hormonal IUD, and the nexplanon. Let's sort of talk about each of those 3. Yes. All right, so I kind of wrote a little summary here for you. Again, with the effectiveness, 95% Depot, nexplanon, and the hormonal IUD up to 99%. Now, the common side effects for the progestin-only injections and implants are either no periods at all or amenorrhea, and the other side of it are the people who bleed very randomly, and for some, quite frequently, and that I would say is the biggest reason people want to discontinue either the Depo, the nexplanon, or the hormonal IUD. Weight gain can be a known side effect specifically with the Depo shot, as well as a decrease in bone density over time. So we always recommend that patients on the Depo take a vitamin D and calcium supplement. Migraines and mood swings is also feedback that I've received for these methods. Now, unlike the estrogen and progesterone birth control modalities, those you'll usually get a period every month in most circumstances, whereas these you probably will not, or it will not be regular. So that's kind of the rundown with this. Now, as far as the Depo shot, as a disclaimer, for some it could take up to 1.5 years for it to get out of your body. So I always like to say, usually when you take out the IUD or the nexplanon, or you stop taking the pills or the ring or the patch, most people can conceive within 3 months after stopping it. Whereas Depo, because for some people it could take longer to get out of their system, they may find it to take a little bit more time to get pregnant. But don't worry, none of these things will cause infertility. Yep. Okay, so I kind of have little models I can show you. So this is your uterus, and so the IUD essentially would get inserted up through your cervix and sit right there. Stay in for, like I said, 3 to 7 years, depending on which hormonal IUD you choose. And then the nexplanon will go with your arm. It can be felt right under the skin, very superficial. And I don't know if you could see it here. It's basically this plastic rod. And of course, with any of these methods, if you do not like them, we will remove them. Yeah, I usually recommend giving the implants about 3 to 6 months for your body to adjust to. Yeah, exactly. And so the last category we are going to be going over is the non-hormonal options, in case you were someone who just wanted to avoid hormones altogether. Yes, so let me write something up for you real quick. Thanks for being patient. All right, and so we have the non-hormonal options. Paragard IUD being the most effective, of course. Same insertion process as a hormonal IUD, but the non-hormonal IUD or the Paragard can stay in for 10 years. Now with this, it may make your menstrual cycles heavier, longer, and crampier, which is why I typically don't recommend it for someone who has very painful, heavy periods or has anemia. And then we have Spermicides. A very popular one nowadays is Phexxi, where you would insert the contraceptive gel right before intercourse, and then if used correctly, around 93% effective, but typical use is in the 80%. And then of course barrier methods like condoms, diaphragms, and natural family planning, where you essentially just avoid having sex during ovulation by tracking using certain modalities. Do any of the progesterone-only implants or the non-hormonal options sound appealing to you at all? It can definitely be scary committing to an implant. So I totally get that. You think maybe you want to start with the pill? Okay. And like I said, we have your starting blood pressure noted. I'm going to send you a 3-month supply of a low-dose birth control. Of course, nauseousness, mood swings, you may experience these things the first month, but by month 3, when I see you again, I would expect you to be happy and not having any concerns or complaints. Exactly. So let me write you a prescription. Okay. I'm very excited for you to get started on your birth control journey. They should be giving you 3 packs, okay? Perfect. So this is for you. You are so welcome. My pleasure as always. And we actually have samples we're giving out, Plan B being one of them, and probiotics. So would you like? Of course. It was a fun hangout today together. But of course, if you need anything, if you experience any concerns, you just call me. It was absolutely my pleasure. I look forward to seeing you next time. See you in 3 months.